Dr. David Rajan. I'm happy that you joined. This actually is a lockdown program we've been doing every Saturday evening, and this is a repeat program. This is diabetes and bone. What are the changes a diabetic can expect in the bone, and how to prevent it, how to keep going, how to remain healthy. So that is the intention of this program. With me is Dr. Elizabeth Phillip, diabetologist, qualified in the UK and practicing with us. And she will be delivering a talk for about 15 minutes. It's all pre-recorded so that there's no interruption. It will be followed by Mr. Ganesan, our chief physiotherapist, teaching a lot of exercises, stretching, how to remain healthy, control the diabetes, as well as control any preempt or prevent any involvement of the bone due to diabetes. So thanks for joining. Over to Dr. Elizabeth Phillip.
Good evening, ladies and gentlemen and children. Today I will be giving you a small talk on the effect of diabetes on bones and joints. I will be doing this presentation on three parts. One is a simple layman explanation of what is diabetes and how it affects our body, and what are the different parts of the body affected by diabetes, how to diagnose diabetes, how to prevent diabetes, and what are the simple things that you can do to manage the bones and joints problem with diabetes. I shall be going over to my PowerPoint presentation on this. Diabetes affects every part of the body, and diabetes affects the different parts of the body because diabetes is a disease that occurs due to alteration in the metabolism of glucose. To understand diabetes simply, you have to understand that glucose is the main energy molecule of the body. Every cell in our body needs energy, and the energy molecule for the body is glucose. Glucose is the simple energy molecule which we get from the food we eat. When we eat food and it contains carbohydrates, it is split down to the lowest form called glucose and it is used by every cell in the body as food. The extra food is stored in the body, in the liver, and it is used when it is required and the food is not available from the food we eat. This is the structure of glucose. It contains 6 atoms of carbon, 12 atoms of hydrogen, and 6 atoms of oxygen. There are other similar molecules with a similar structure, but they may be an alteration in the chain form due to which it cannot be used as food. Only glucose is the energy molecule of the body. Now, this energy molecule called glucose reaches the bloodstream from the food we take in. Suppose you were to eat rice, it is broken down in the stomach and in the intestine to glucose, and it is absorbed into our bloodstream. In the bloodstream, it reaches the cell with the help of this hormone called insulin. Insulin is a hormone which is produced by the pancreas. This is the basic simple structure of glucose of 2 amino acids with links in between. It is produced by the beta cells of the pancreas. There are 90 million beta cells producing insulin in the body. 90 million in Indian terms is 900 million beta cells producing insulin in the body. 900 million in Indian terms is 90 crores. To understand that, we should understand that the population of India is 139 crores. So we have almost 100 crore beta cells in our body producing insulin. How does insulin help or affect the glucose utilization by the cell is what I will be talking about next. This is a simple schematic diagrammatic representation of what happens. So the glucose is flowing in the bloodstream. When a cell needs the glucose, the insulin receptor will send a sign saying that the insulin should be attached to this. When the insulin is attached to this receptor, it unlocks the glucose channel. And if the unlocked glucose channel is unlocked, glucose can enter the cell. And the glucose can be utilized as energy molecule by the cell. So there are 3 different steps here. 1, the insulin should be The key to the insulin should be unlocked, and the insulin should unlock the key and allow the glucose to enter. So if there is any problem in either the insulin level, insulin production, or any problem in the glucose metabolism, this does not happen and the cells are deprived of glucose and the glucose remains in the bloodstream. This can happen either due to lack of insulin or the insulin does not work due to a condition which we call insulin resistance. So what happens when this glucose is not utilized by the cell? It is flowing in the bloodstream. In the bloodstream, this high blood sugar flowing for a long time creates the problems which happen in diabetes. To understand that, I will be going to the next step, which is a circulation system in our body. We have a fantastic circulation system in our body. The red pipes that you see are the pipes that contain oxygenated blood along with glucose and all the other molecules are required for the body. And the blue is what is remaining of the deoxygenated blood, what the cells have utilized and returned back, which is returned to the heart and lungs, oxygenated again, filled with glucose in the intestines and returned back to the cells. So these are a series of pipes which reaches every micro nanometer of the body. Now these series of pipes, when they carry blood with high glucose levels over a period of time, this glucose along with other deposits like fat get deposited on the walls of these arteries. The deposition of this glucose and its end products along with other factors cause minor narrowing in the blood vessels or blockage in the vessels. This blockages in the heart results in what we call a heart attack. A blockage in the brain causes a stroke. A blockage in the feet can cause ischemia or lack of blood supply to the feet. In addition to these major blood vessels, in our body, these arteries and veins are connected over a minor blood vessel system called the arterioles and the venules over a string of capillaries. These are again a series of tubes which are very minute single layered cells, and in this level also, if the blood sugar is high, they can cause the walls of these blood vessels to break, which we call microaneurysms, and they also affect the functioning of the organs. Now, for example, going back, if the microcirculation is affected in the eye, it causes microaneurysms or bleeds in the retina, which we call diabetic retinopathy. If it happens in the kidney, we call diabetic nephropathy. And again, in the nerves, there are a series of blood vessels surrounding these nerves. And if the blood supply is cut off due to that, the nerves are also affected. So from this, you can understand that high blood sugar affects every centimeter or every nanometer of the body. The effect is not immediate, but it is over a long time. Going to the next one. So then what is normal blood sugar? A fasting blood sugar below 105 milligrams per deciliter is normal. 2 hours after food, any blood sugar below 140 is normal. And of course, we have an indicator of average blood sugar, which is an indicator of the average blood sugar for the past 90 days. If it is below 5.7, it is normal. In any step, there is always symptoms before the disease occurs. So there is a stage in diabetes also called pre-diabetes. Pre-diabetes is a stage in which the fasting blood sugar stays between 105 to 125. 2 hours after food, the sugar is between 140 to 199, and HbA1c is between 5.7 to 6.49. This is a very crucial stage because if a person can be discovered to have pre-diabetes, you can prevent diabetes or postpone diabetes and all the problems in the arteries and the body that can happen due to it. So then you should understand who are the people who are prone to diabetes. If you were to take the family history, a person with a father or a mother is a diabetic, the chances of that person becoming a diabetic is 40 to 50%. If both parents are diabetic, there is a 90% chance that that person can become diabetic. If suppose one parent and a second relative, like an uncle or an aunt is a diabetic, chances are 70%. If you are a mother who has given birth to a baby whose birth weight is more than 3.5 kgs at birth, That is also an indicator that the mother can get diabetes in the future. And during pregnancy, if the mother has diabetes, a condition called gestational diabetes, which is usually treated with insulin or diet, that also indicates that in the future, 5 to 10 years, the mother can get diabetes. So understanding this, if we can detect prediabetes, we can prevent a huge, major disease problem in the world. This is diabetes. If the blood sugar is above 126 and the fasting blood sugar is above 126 and after food is above 200 or HbA1c is above 6.5, you are a diabetic. So please remember this because it's very important for all of us. What does diabetes do? I have already spoken earlier. I will be re-emphasizing the same facts again. It damages all the blood vessels to the heart, the blood vessels to the brain, the blood vessels to the kidney, the blood vessels to the eye, the blood vessels to the feet. It damages the nerves all over the body. Nerves to the feet are very long, and because of that, when blood supply to these nerves are affected, especially the sensory nerves. We have two types of nerves, what we call motor nerves, which affect the functioning of the body, and the sensory nerves, which give us a sensation of touch and pain and all that. If those nerves are affected, you will have loss of balance because there will be numbness in the feet, woolly sensation or burning sensation, etc. And these kind of nerves are also present in the stomach and intestine and can lead to neuropathic symptoms like vomiting and diarrhea, etc. Just like the blood sugar is high in the bloodstream, they are also deposited in the fluids around the joint. The joint is a very mobile unit, which has to be mobile because of the synovial fluid around the joints. When glucose is present in these joints at very high levels, they deposit as advanced glycation end products and they can damage the joints also. Bones, structure and strength is also damaged due to the high blood sugar and its effect on the functioning of the bones. What are the effects on the joints? If you are very sensitive about your body, you will notice a simple minor thing. You're sleeping in bed and you just notice that you lift your shoulder and it pains, or you wake up in your sleep because of pain in your shoulder. Or you have heel pain, you just wake up from bed, start walking and you cannot walk because there's pain in the heels. Or the small joints are very stiff. These may be signs of diabetes because studies have proven that 29% of these people with these simple small problems may have pre-diabetes. If you were to look for these signs or notice these signs and just check it out, you are at great benefit because you can prevent a huge disease just by diagnosis and paying attention to small symptoms. How do you manage? Manage pre-diabetes, manage joints and all that. Pre-diabetes, as I told you, pre-diabetes is a precondition which can be prevented. Fortunately for this, the only two things are diet and exercise. Exercise will be spoken about by Mr. Ganeshan, who will be giving you a detailed explanation after this. For the diet factor, it is very simple. What we can do is reduce our oral intake of glucose. That means we take foods that do not change to glucose. That is basic mechanism. I will be explaining it later. If there is symptoms, please visit a doctor or a dietitian, a diabetologist who can probably test for these things and look out for other reasons. Please remember that shoulder pain, heel pain, and small joint pains can happen due to other reasons also. But you can confirm that you do not have diabetes just by this simple test. If you are a diabetic, control your sugars. It's very important. Keep the HbA1c below 6.5 to 7 so that you do not develop the complications in the arteries due to the disease. As I told you earlier, this is an example of the diets you can take. Plenty of vegetables and fruits. I have included fruits. You must be wondering, fruits are sweet. How come it does not happen? As I told you, the sugar in fruit is called fructose. It is similar in structure to glucose, but it cannot be utilized by a cell as energy molecule because the structure is different. So to a small extent, fruits are good for our body. All vegetables are not reduced to a large extent to sugar in the body because it contains fibers and vitamins and water, etc. Due to which the amount of glucose that is produced when you take vegetables and fruits is not as high as when you take rice, etc. The other kind of food that is important is dals. If you were to take 100 grams of rice and eat 90 grams is going to be converted to glucose. On the other hand, if you were to take 100 grams of any of this dal, rajma, pasipairu, kadala, or any of these pyruvable, only 60% is converted to glucose. So you are reducing your own intake of glucose load just by this tiny method of changing food that you eat. Please remember this if you are trying to prevent diabetes. This is the long-standing effects of diabetes on the body. Neuropathy. You have burning feet, you have numbness in feet, you cannot walk properly. This is because of the damage to the nerves, which can be corrected only by control of diabetes and returning of the blood supply to the nerves to normal. Nails become very thick. You cannot cut it with a nail cutter at home. The skin becomes dry and it cracks because all the skin contains oil cells and sweat glands which produce the sweat and the oil, and this is all dried up due to diabetic neuropathy, due to which the skin is cracked and becomes dry. When this happens, due to the neuropathy and absence of sensation, you can get injured. A pin can prick you. You will not know any kind of pain at all. So injury without pain is another thing. And in addition, if the sugar is high, that can lead to infection, blood formation, and worse things. This is the change which we call plateaus that happen due to diabetic neuropathy. What happens here is the pressure points in the foot are changed to the tips of the toes and the arch. This change in pressure points cause that particular region to be injured, and if the injury goes deeper, it affects the bones. Bones are weakened due to diabetes, as I told you. The weakness is in the bone structure. The weakness in the bone structure is to diabetes itself. In addition, some drugs that were used for diabetes earlier can weaken the bone structure. It is not used much because of these problems now. You are prone for fractures because you will lose your balance because of neuropathy and you cannot feel the sensation in your feet. Infections, as I told you earlier, because of infection from the skin going deeper down to the bone. Any infection in the bone is called osteomyelitis, and osteomyelitis may lead to a condition in which its finger has to be cut off, which is called amputations. The last one is in kidney failure, since the metabolism of calcium and phosphorus in our body is also mediated by the kidney. In long-standing diabetes with kidney failure, bones become fragile, they are as weak as butter. Due to all these things, diabetes affects the bone structure and diabetes affects the joints. So it is up to us now to make sure, if you are a diabetic, to keep it under control, to prevent all these problems that happen due to diabetes. And if you are in a pre-diabetes, please prevent it with the measures that I have told you. Whether it is the best of times or it is the worst of times, this is the only time we have. So how we live it is up to us. I hope you can use these small guidelines to make your life at this time better. Thank you.
Good evening, everyone. So in continuation with the talk, what I'm going to discuss is on some of the exercise possibilities and modifications and key tips what you can take forward with your exercise plan. So points to consider any diabetic when you're going to have an exercise program. First thing is you need to know what kind of an exercise will be suiting you. Mostly it is an aerobic form of exercise, but you might also need to incorporate a little bit of flexibility, strength training, and start with a moderate intensity and progress gradually. Talk to your doctor about the exercises, what you are going to do, whether it is the recommended form, and have your emergency medication and sweets and all those things, just in case you drop down. Now, these are some of the gadgets you can have. A lot of the time you will know that people have these watches which are incorporated, which can show you what is your metabolism, what is your heart rate going on, and how much calories you are burning, because those are the things that can help you to understand how is your exercise intensity going on. So you need to balance your diet, exercise, and insulin. Now, all these things can be monitored when you have a proper meal, knowing how much calories you are intaking. Your diabetes can be monitored. Most of them have this at home, or you can have something with you which you can monitor on, and knowing how much calories you're burning on each session. So all these three components, once you monitor, you will know whether it is going in the balanced form, and this will help you progress and plan your exercises. Now, types of exercises, the aerobic exercise is more of a low intensity exercise, but for longer duration. And the effects in terms of the glucose level is expecting to drop down. And if you're going to do a high intensity, short duration anaerobic exercises, which can be a weight based exercise, you can have the spikes to change, which is again not going to be a gradual drop, but there can be sudden changes. And combination again will give you fluctuation, and it can go. So ideal exercise is going to be more of a aerobic based exercise. Now, what are the guidelines or you need to have as a principle is your fit principle. That is your frequency. You need to have how many days a week you're going to do, what is the intensity you're going to move, and the time duration, which will include your warm up, cool down, stretches, all. So you need to have that as a principle and then follow your exercise format. Now, this is a sample program. I'm just giving you how you can maintain it. So you can see I'm taking up 7 days a week, and you can see that the dynamic stretches or simple movement based stretching program, which is incorporated in the first thing in all days for about 10 minutes. And this will be your main exercise. That can be walking on one day, you can do cycling one day, again walking, then you play a mild sport, again cycling, even dance or aerobics. So finish it off with a cool down session of yoga or stretches. Now, if you see that the entire session will be for about 1 hour, but you are changing the main exercises so that you can allow different systems to work and different muscles to participate. So there is all around muscle function happening. Now, this is a simple program of a body-based movement. This can be your main exercise itself. You can start with simple exercise. Again, remember, for diabetes, you need to have a long duration, low intensity workout. So the recommended exercises are basically your basic anatomical movement, what we call, what our body is made to do. So we're just going to use those movements, and you can do about 20 repetitions at your own pace. So the basic idea is to burn off those excess calories as much as possible. You don't have to do these exercises going on to the extreme range. Even if you have some limitations, you can do at whatever range is available. But the idea is to just keep going on doing the exercises. You can also do these exercises in a chair where you can just sit and do. You can also do these exercises in a lying position on a cot or on the floor. So always remember to do stretches, even if it is a very mild form of exercise what you have done. Make sure you do your stretches. Now, walking and cycling. A lot of the time, the misconception we feel is patients are asked to do walking, and they keep doing a lot of walking, and they can develop pain on the foot or on the knee. or people who have an arthritic problem, when they walk, they are going to even more load the knee, and that can is more of mobility, whereas it loads the knee. Also do a home-based cycling program where you can use a recommend cycle, or you can see here it's a simple pedal form and a chair. You fix it against the wall and you can perform this for about 15 to 20 minutes. This is a slightly higher level of aerobic workout. So people who have a slightly better fitness can try and do these. This is a very common exercise known as the burpees, where I've modified it to a lower intensity level. So you're trying and using your functional movement from your hip, knee, trunk, shoulder all together, and you can go at your own pace and try and do as much as repetitions you can. So if you can do about 10 repetition, and then you can shift to another form of spot jogging, what I'm showing you here. So now you are using only lower limb, and once you get press, you can work on the high stepping knee. This is a standing core exercise. Again, you can do the entire cycle as a different form of aerobic exercise, where you use your lower limb, core, shoulder, everything here. So again, remember to do the stretches after your exercise program. A basic strength is required for everyone who wants to do any form of exercise. So for diabetic people, you can incorporate your basic strength training along with your workout. This is using a resistance band. So you can initially do them probably on alternate days, and then do twice a week. This will also burn your calories, but will also maintain your strength, what is required. This is squats. So if you can do first by holding, then you progress to sit to stand without support. So this can be a good form of exercise for people who have knee issues. So coming on to shoulder, as ma'am had mentioned about how diabetes can cause various shoulder problems. People who are pre-diabetic or post-diabetic with shoulder problems will have pain and something what we call as irritation, and this can slowly cause them restriction on particular movements, and slowly they progress into a condition called as periarthritis of shoulder or frozen shoulder. Now, for these patients, they can continue using a lower limb on exercises, what I've shown on the previous two videos. And you can also switch to a little bit of walking and cycling, so that you can still continue to burn those excess calories. And the pain management is something you can use either a cold pack, medication, and injection. And if you find this is the common movement, what people complain, that I'm not able to take my hand behind my pocket, not able to wear my dress, comb my hair. And the exercises at this stage will be mostly to control the pain by using medication, injection, or cold pack, and maintain whatever range of motion is available. And then we progress to a graded exercise for restoring the movement, and then progress to strength training. So this is a simple exercise and stretches when you can do with pain and to maintain it. These are simple shoulder mobility. So usually these tends to get stiffer and the muscles go spasm. Now using a cane is to give orientation and feedback to you, trying to do as much as movements as possible. You have to do at the manageable pain zone, and this is the movement which is mostly restricted. So you use the effort of this hand to pull that in. So this will be progression. Later on, if your hands are little moving on, then you progress to this position and move the exercises. And this is another common movement which is called a shoulder abduction, which is very badly affected. And this is a bad pattern of movement which should be avoided by people. This is a good stretch for the biceps or the anterior shoulder line. Now coming on to the foot, the basic problem with foot is in the diabetic foot is the pressure variation. So a foot scan will reveal that if the pressures are in the appropriate place, and usually we have to have a proper distribution of the weight from the heel to the toe, and when you walk that distribution should be appropriately right. You can have a bad posture at the trunk or in the shoulder, and that can vary your pressure variation. And when you have these variation in the pressure, you tend to get these calluses, which are nothing but an indication of overpressure in that area, and the skin gets thickened up, and that can later on lead to a wound. So this has to be noted for diabetic foot. And cons are areas where the footwear is either causing more pressure and eroding them. And again, these can cause blisters and cause a wound, which is very difficult to treat. Sometimes people are recommended to have an orthotic footwear based on diabetes to alter the abnormal pressure going on in the foot, and those are custom made for the patients. Pain in the insertion area is where you get these pain around the heel where you can see, and these are pain along with the diabetes where they can have a pain which can cause because of walking or getting out of the bed, and some form of stretches will easily relieve this pain. And people, when they have this heel pain, they have this difficulty to go on to their routine walking and cycling, and they have to modify their exercises to the trunk and shoulder based exercises. So this is how you can do the stretches irrespective of you have pain. This is a very good stretch for everybody to perform, and for diabetes particularly, they need to perform quite regularly when they are on their walks, or even when they don't have pain, because they don't want to allow that tension to come on the calf muscle, which can trigger the pain on the foot. So these are various methods of doing a calf stretch. So people who are having a hypertension and diabetes, both needs exercises, but both are two different systems. So understand that when you do an exercise for hypertension, which probably is around level 1 and 2, you need to work at a target heart rate, which is about 60 to 70% of your target heart rate. So these exercises will be slightly at a higher intensity than the diabetic person, so that it gives the desired benefit for the hypertension. And as you finish your walk, the whole component of walking itself is going to help in burning those excess calories for the diabetes. So the take-home message is monitor your glucose level, monitor your exercise, monitor your diet, and always plan your exercise not in a monotonous way, in different forms like cycling, games, dance, aerobics, anything. So keep safe and exercise regularly. So thank you very much, and you can follow up with our other programs on our YouTube channel at Ortho One. And thank you very much.